When we see why blood in circulation does not clot, this is the obvious question that came in our mind. Now, what are the response? What are the reasons why blood in circulation does not clot? The most important factor responsible to it is velocity of circulation. Second, smoothness of endothelium. Third, circulatory anticoagulants. Fourth, fibrinolytic mechanisms. And fifth, removal of activated clotting factors. These are a number of factors which are responsible for or this doesn't allow the blood in circulation does not clot. When we see in detail, that is velocity of circulation is important. The smoothness of endothelium layer. That smoothness of endothelium layer of glycocalyx, that is mucopolysaccharides, repels coagulant factors and it acts as a barrier. When we see the third factor, that is circulatory anticoagulants like heparin, antithrombin 3, alpha 2 macroglobulin, protein C inactivates factor 5 and factor 7. When you see this fibrinolytic mechanism, which plays an important role and prevents blood from clotting in normal physiological conditions. And the last one is very important, that is removal of activated clotting factors. When you see these anti-hemostatic mechanisms, it prevention of platelet aggregations. This is the first part, an important part of anti-hemostatic mechanism. That means this anti-hemostatic mechanism means the mechanism that prevent hemostasis. That means blood clotting. First, very important, that is prevention of platelet aggregations. When we see this, another one, that is circulatory anticoagulants like heparin, antithrombin 3, protein C, etc. When you see this heparin, basophils and mast cells facilitates action of antithrombin 3, prevents activation of prothrombin. It prevents action of thrombin on fibrinogen. When you see another factor, that is antithrombin 3, it inactivates number of coagulants. Action is increased by heparin, while protein C, which helps in fibrinolysis. When you see this fibrinolytic mechanism, this is the very easiest graphical presentation showing you or explaining you this fibrinolytic mechanism. In this fibrinolytic mechanism, plasminogen is converted into plasmin, while a plasmin is further converted to lysis of blood clot. Lysis of blood clot subsequently causes removal of small clot in tissues and reopening of blood vessels. These plasminogen activators are formed from injured tissues. When we see this thrombosis, that means intravascular clotting of blood, which is predisposed by endothelial injury, alterations in flow and hypercoagulability. These are the predisposing factors concerned to thrombosis. Deep vein thrombosis and coronary thrombosis. These are the some specialized or localized important thrombosis. When you see this artificially produced TPA is used in coronary thrombosis, urokinase and streptokinase. Urokinase type of plasminogen activator is found in endothelial cells, renal cells and tumor cells, while streptokinase bacterial enzyme causes activation of plasmin like TPA, UPA used in early myocardial infarction. When you see this physiological importance of fibrinolysis, it is important obviously for cleaning of minute clot. Secondly, it promotes tissue healing, and lastly, it plays an important role in liquefaction of menstrual clot.